you have a statement, right? And so this is, something that they prepared by consulting 24 different CSOs. So instead of reading it, if you just highlight the key points,
yeah,
and then make sure that they have a copy of this.
Okay, thank you very much. Good afternoon and namaskar to everyone who are in this room and who are joining online. Before submitting the hard copies to the Honorable Vice Presidents, I'm going to highlight a few points of our signed inputs. My name is Om Thapaliya and I represent the group of Nepalese organizations called Social Protection Civil Society Network. Our statement concerns the people-focused areas of IDA 21, and I'm making it on behalf of as many as 24 organizations from national, regional, and global arena. We are convinced that building strong, right-based social protection floors and strengthening public systems of delivering health and education holds the key to addressing the public crisis that IDA countries are facing today. As the World Bank dominates the international financial support to social protection building, the direction that IDA 21 takes will have an impact that goes beyond the program that IDA will finance. With regard to social protection, we regret that the World Bank wants to limit social protection to narrow safety nets targeted at the poorest and most vulnerable. The World Bank, we know, the World Bank committed to universal social protection already about 10 years ago, and today we know that poverty-targeted social protection is not suitable for achieving universal social protection floors. That is because it cannot be done accurately, rather it generates high rates of exclusion errors. It can undermine trust of governments and exacerbate the risk of unrest, and it can undermine rights and dignity and government gendered stigma. We recommend you that replace the first focus on poverty targeting with a focus on building universal systems. This should be right-based, gender responsive, and in line with the ILO recommendation 202 and social protection floors. In addition, climate risk, including slow onset climate impacts, must be integrated in all social protection programming. It is often argued that it is too expensive to build universal social protection in low and middle income countries. In that context, it is appropriate that this IDEA forum takes place in Nepal, which offers a clear example that it is indeed possible to implement universal social protection in a low income country and post-conflict situation. With regard to health and education, we welcome the commitment to universal health coverage, but call for a clear commitment to addressing financial barriers to healthcare service access. Likewise, we are concerned that the proposed focus on learning poverty risks moving away from the holistic vision to the SDG commitments on education. We recommended that the IDEA 21 invest in universal right-based public systems of education and healthcare that ensures the availability, accessibility, acceptability, and quality of these services. In particular, I would like to highlight the need to scale up and sustain an adequate, qualified, skilled, trained, and motivated workforce in education and primary healthcare, particularly strengthening the patient working conditions and addressing the unequal remuneration and opportunities, especially for women. IDEA should establish strict rules of engagement, accountability, and transparency to limit conflicts and interest between the private sector and the citizens. We also call for the support to increase medicine research and development and manufacturing capacity of IDEA recipient countries, gender-based violence prevention and response efforts, and advancing sexual and reproductive health and rights to health care and other services, expanded access to quality and economically accessible child care, elder care, and disability care services. And finally, given the renewed World Bank focus on inequality, we call for the bank to establishing a tracking inequality special theme, building on its inequal indicator in the scorecard. Also, in addition, stand-alone commitments to address women's and gender minorities, right? These issues must be included across the individual focus areas. Thank you very much for listening our input statement. Now I would like to request to give me 2 minutes more to hand over the
Yeah,
hard copies to the Honorable
sure.
Vice President.
Yeah,
Thank you,
please
sir.
do that. And so this is really fascinating that somebody actually went through all the documents, decided to meet as a group of 24 and then actually prepared a written response. So I think it's something to be recognized. Thank you very much. So yeah, just go ahead. So, we'll just continue. There are,